We invite the next speakers, Mrs. Andrea Bilbao from Adhd Charity Association. Now we have seen at the moment an academic overview of how it is possible to treat the ADHD problems. So Andrea explained us how these association use strategies.
What we've learned from
yes,
parents.
What is learned with parents. Yeah. Okay, thank you.
Can I just ask, are there any parents here, parents of children with ADHD? No parents here. Oh, we have a parent there, okay. No, just to say that I'm happy to talk to any parents later if they want to talk. Okay. So we're going to look at the improvement in health of individuals with ADHD and what does that mean? And why? Why are we looking at this? Because if we don't deal with these children early on, this is what happens. And this is what we found through our own research. Parents, so many parents are on antidepressants because they can't manage and live with their children. Lot of breakups in the family, divorces, separations, breakdowns. The inability to maintain employment. If you have a child with this condition, you're called to school practically every day. You have lots of doctor's appointments. Your child is sent home. It's very difficult to hold down a job when you've got a child with ADHD because they become a full-time job. And many children with ADHD are actually placed in care. They're taken away from their parents and given to other parents. The children, they develop low self-esteem, very poor relationships between the parent and the child, and also poor relationship between the teacher and the child. You know, teachers don't really like having children with ADHD in their classroom. Children don't develop good friendships. They may make a friend, but actually, you know, within a day they've lost that friend, so they don't sustain friendships. And school exclusions are just, this is the reality of ADHD. So many children are excluded from school, and this is happening all over the world. This is not just, you know, for one country. And I think that our biggest job is to keep these children in school. They've got to stay in school. They've got to get an education. Because without an education, as adults, they drop out of school. The biggest casualty of ADHD is educational failure. They start to self-medicate, turn to drugs and crime, the knock-on effect of drugs. Gambling is a big risk, poor money management, addiction to drugs, addiction to alcohol, addiction to gambling, addiction to sex, addiction to almost anything. As adults, low income or no income, inability to hold down a job. In the UK, the Home Office have told us that poorly managed and untreated ADHD is one of the top 5 causes of youth crime. As an adult, a lot of adults, their own relationships break up. They have difficulty parenting their own children. They have difficulty sustaining marriages. And then we know from 27-year longitudinal study in the UK by Professor Eric Taylor that if we don't treat ADHD in childhood, many adults with ADHD will go on to develop other severe psychiatric conditions. So, how do we get it right? Clinicians, it starts with clinicians. Are they using everything in their toolbox? You know, are they over-reliant on medication? And what that means is, you know, I'm very pro-medication, but are clinicians only using medication as a way to treat ADHD? They have time restraints, they have resources but they don't use them, or they don't have resources. And very often they're not using the best of their resources. So we've got to look at how we get this right. What do we have to do to get it right? We have to identify what is working well for these children. And the key people involved are the doctors, the teacher, the parent, the patient. These 4 people are crucial. They have to work together and they are partners in the management of ADHD. Because even parents, parents have a huge responsibility because they need to understand what's going on. Other professionals who come into contact with the children, as you probably know, youth offending services, the police, social workers, a lot of people involved, they need to understand ADHD. If we get it right, we can very dramatically improve the outcomes for these children. This is a survey that we held just recently this year, and one of the things last year, we asked our parents, when you received a diagnosis of ADHD for your child, were you offered a parenting course? Only 30% of parents were offered a course. Were you offered any kind of parent education course to learn more about ADHD? Only 11% were offered us. You know, parent education is probably the most crucial aspect of the treatment of ADHD. It's so important that parents understand this condition, because they don't understand it, they cannot be part of the solution. Did your consultant give you any written information? Well, a fair number of consultants did, 64%, that's good. But you know, a lot of parents of children with ADHD don't actually read. Did your consultant allow you to choose which medication would be best for your child? Because in the UK and in America, you know, there are a lot of different medications that work in different ways, and it's really important that parents do have a say in the medication. Only 36% were involved in that decision. I'm going to show you a little case study. This is Sam. He was excluded from school for being violent towards teachers, lots of exclusions, very aggressive. He became depressed, he was suicidal, he was self-harming, falling behind at school, and his mother just felt that she failed as a parent. Now, you're probably sitting there thinking, we need to do something about this child, we need to treat him. But going back to my previous point about are clinicians over-reliant on medication, Sam actually has a diagnosis, and he is on medication, but we're still having that problem. Why is that going wrong? What are we going to do to get it right? So Mum took him for a second opinion. A new doctor who didn't just give him medication, but they talked through the medications so that Mum could understand it. They made a decision together about the best medication. She gave the mum a lot of information about the condition for herself and for school. She took time to talk to the boy to find out that he understood the condition, and she wanted to know from him where he felt he needed extra help. They were put on a waiting list for psychotherapy. They received family therapy. The doctor went into school to talk to teachers and the people in school to understand what was happening in school. The doctor actually initiated teacher training in school. She put the parent in touch with us, and she came on our parenting course. So this child was approached from all directions. Okay. So after all this intervention, this is what happened to him. His school report was brilliant. His reading and writing levels increased dramatically. He was on target for maths. And his self-confidence was boosted. His self-esteem improved. And he just went from strength to strength. School exclusions are very, very common with ADHD. And one of the problems is that parents and schools don't understand the disability aspect of ADHD. A lot of people still don't understand why this is a disability. And when we look at the executive functions in the brain, and you probably know much about this, a lot of the way the brain works creates that impairment. You know, the inability to manage time, for example, the inability to regulate your emotions and to regulate your impulses, the inability to organize your thoughts and to organize yourself. Working memory is very poor in children with ADHD, and I think that contributes greatly to the impairment of children with ADHD. When you're constantly giving child instruction as a teacher or a parent, and the child is forgetting what you're saying and they're not doing what you ask, and they get into trouble. You know, forgetting homework, forgetting to bring in their kits for PE. The diagnosis, I think one of the other problems that we have with ADHD is that very often the ADHD diagnosis comes first, But there is a huge comorbidity with autistic spectrum disorders, and very often that condition doesn't get diagnosed. So we find that we're throwing medication at children who may have both conditions, and it's not working. And you're not seeing improvement, and especially in secondary school, there's a lot of problems. And very often it takes a long time to get to the point where somebody thinks, there may be an autistic spectrum disorder here, and maybe we have to work a little bit differently with this child. So, working with parents, what have we learned so far? We've learned that parents don't like being told that they're not good parents. They don't like being told they need to go on a parenting course, because I think most of us parent instinctively. They will receive that information better if we talk about it maybe as being a parent education course, because I think that's what they need, not parenting, parent education. The usual parenting programs that parents are sent on are generic and they're far too long. Parents drop out. They're not really appropriate for the needs of children with ADHD. Because parents want, first and foremost, a tool to tackle behavior. That, I think, if we can get the behavior out the way, we can then learn to parent properly. So as an organization, what we recommend as a frontline treatment for ADHD is parent education, a psychoeducational program that teaches them about the condition so that they can better understand how to parent their child. A program that incorporates into it a behavior management program. We use something called 123 Magic, which is it's a behavior management program, incredibly effective, and you probably think I'm making this up, but actually it's a program that works overnight. And it's a program that can also be used in school to manage behavior very, very quickly without shouting, without yelling, and by creating some harmony in the home. There's a website there, you can find out more about it there. The other thing that we recommend is a program that can be delivered in school. It's a cognitive behavioral therapy program, solution-focused, multisensory, using visual analogies, using activities, using music, reaching children the way that they learn. The program is called Why Try? And have a look at the website. It's a program that you can use from the age of 4 up to adulthood. The aim of the program that we use is to increase the knowledge of parents, increase their knowledge, to increase the knowledge of teachers, and to empower parents to become better advocates for their child, both in school and, of course, in the community, where a lot of parents will get negative comments from their own friends. To help parents understand the disability aspect, educate parents on strategies that are really effective for managing behavior, and also to teach children critical social and emotional skills, and also this very important thing, resilience. We need to build resilience, because sadly, a lot of children with ADHD, a fair number, commit suicide. And we've just had 2 or 3 in the last year back home. So the program that we use, 123 Magic, this program, we teach parents how to sort behaviors, to understand the different behaviors, and to choose appropriate responses. There are 2 different kinds of behaviors. There are behaviors we want to stop, and there are behaviors we want to encourage. And there are different approaches for those behaviors. We teach parents and teachers to manage those difficult behaviors without the yelling and the arguing, and of course, the smacking. We learn how to encourage positive behavior through a series of rewards, encouragement, and praise. Just go very, very quickly through the program. I'm happy for you all to have copies of these slides. I'm very happy to share them with people here. So in the session 1, we will teach parents about the condition, and we will look at the positive aspects of ADHD. In session 2, we get them to think about the tasks involved about being a parent, and then what extra tasks if children are diagnosed as having ADHD. Because often parents are referred to us pre-diagnosis. This is a really good program for differential diagnosis. We look at the different parenting styles and think about which styles we're going to use and whether this is the best way to introduce 123 Magic. In the next session, we will teach them to sort their behaviors, to understand the behaviors, and also the importance of good communication, reinforcing positive behavior. Again, looking at positive behavior using rewards and praise, strengthening the family and school relationship, building self-esteem, also giving parents information about the education system because they need to understand how to advocate for their children within the education system. Sometimes you can't always rely on the school to get it right. And then we review the program and evaluate it, and then we celebrate with certificates when they've completed the program. What we've learned from these programs is that parents are incredibly resilient themselves, and they do respond well to programs that work. And if they work, they will continue coming. They benefit enormously from group work, because we found that in an individual setting, it's really hard for them because they do feel very isolated. After they finish these groups, it's really important, and again, this is the role of the voluntary sector, to provide ongoing support. Because we find parents who are put onto parenting programs come back to us and they'll say, well, the program is finished, now what? I'm left alone. You know, this condition is not curable. They're going to live with this for the rest of their lives, and we have to build up that scaffolding around these families and not pull it down. So when they come on these courses, they learn a lot of skills. We've got to keep that scaffolding in place and keep them supported. My personal journey, when my children were diagnosed when they were aged 5 and 9, they're now 26 and 30, so I've gone through all of this. My 30-year-old is a university graduate, and my 26-year-old, he's got an autistic spectrum disorder as well, so he's a bit more impaired, but he's a well-functioning, happy person. I decided to make myself as knowledgeable as I possibly could be in order to help my children. And I came up with a formula to get parents through, and I want to share this formula with you because I think it's really important to give parents hope. As parents, we have to become the expert in this condition. We have to know everything about this condition, because if we don't know about the condition, we don't know how to fight for the services and the support that they need. We have to know and understand our child. We have to become an advocate, and we're going to be advocating for our child right through up until they're an adult. They never stop being our children. Even my 30-year-old son comes to me for help and support still. I still have to give him that, that reassurance. As a parent, we've got to be a positive role model. And the 1, 2, 3 Magic program actually helps us look at our own behavior as a parent and changes our behavior. Because we can't have expectations of our children if we are demonstrating poor behavior to them ourselves. So we've got to change our behavior. And I think that's the first thing that parents actually learn when they come on our program. We don't teach it, they come to that realization themselves. As a parent, we're going to have to be very patient with our children and invest in quality time, a lot of one-to-one time with our child. We've got to find their islands of competence. We've got to find what they're good at, because many children with ADHD fail in the education system, so let's find something they excel at outside of school, something we can invest in and support them with, a place where they can feel good about themselves and they feel success. We have to support their hopes and dreams, and we have to be the shepherd that guides them, even if sometimes it may be over a cliff. This is my older boy. He's a whitewater kayaker. And from the age of 11, he started kayaking. And he went every single weekend, and we invested in this because school was a really bad place for him. But he's become a world-class kayaker. He kayaks all over the world. He makes videos, and he's done really well. So, if we invest, we have a few Olympic champions who have ADHD, didn't do well at school, but are doing brilliantly in sport. So we've got to find their goals, help them find their goals, let them know that those goals are obtainable with good, hard work. We've got to keep them focused on those goals, and as parents and as teachers, we mustn't give up on kids with ADHD. If we invest in children with ADHD, you get so much back from them. If we don't invest, all we're going to get is pain. The role of patient groups, this is really interesting. Parents and children spend very little time with a clinician. These appointments aren't very quick, and how many times do they see them in a year? Not very often. They spend a lot of time in the parent groups, often going to parent group meetings, maybe fortnightly, maybe weekly, maybe monthly. And yet the resources in those parent groups are very poor and very small because we don't have money. Clinicians have access to resources, but they don't spend that much time to use those resources. So what is the role of the groups? What can we do? parents tell us that support groups have been the most important and the most helpful discipline out of all the disciplines. We need to create toolboxes that the voluntary sector can use. You know, as a voluntary sector organisation ourselves, we've learned so much that we've developed our own teacher training programs, our own parenting programs. We have so much to offer, but we do lack the money to get these things properly manualised and put into place. We've developed psychoeducational programs, teacher training programs. I'm part of ADHD Europe, which is an association of the European patient groups across Europe, and we're doing so much now to support families and patients and teachers. We have a lot of professional members. So what are the strengths of the European associations? They have a vast amount of knowledge and skills, lots of experience of working with individuals. Working together through Europe, we're able to share a lot of information and strategies. We have a lot of professional members. We share resources. Very, very effective at awareness raising across Europe, and we've lobbied the European Parliament. Voluntary sector are best placed to educate the public. We've got more time, and we're driven by passion and not by paycheck. And I think that's really important. You know, we work very long hours, and we work on this so hard because we truly believe that these children are worth that investment. What are our weaknesses? I think language and culture sometimes are a barrier to working together. And funding, I think that's our biggest weakness. Self-help for parents. You know, self-help is really difficult for parents of children with ADHD because many of them don't read, many of them have ADHD themselves undiagnosed, they can't retain information, they can't organize themselves, they can't get it together to get themselves you know, supported. So we need to build that scaffolding around parents as well and give them the reassurance. A lot of parents, however, are computer literate, and that's a strength. That's something we need to work on. Social networking, you know, I've been using Facebook now for the last year and various other Twitter. It's been an absolute eye-opener, social networking. I think it's been an absolute lifesaver for so many parents. They get so much help and support through joining groups on social networks. So e-learning, a really effective tool for parents, and I think this project is going to be quite good for parents. I think it's a good way forward. So a take-home message, really, we need to listen to parents, we need to listen to what they're telling us, we need to listen to what teachers are telling us, to their experience. Giving a parent a leaflet is not enough. Giving a teacher a leaflet is not enough. We need to look at the difference between the psychoeducational courses and parenting courses, what is working better. We need to make sure that parents have got skills to become good advocates. We need to give parents and teachers really good behavior management tools and strategies, really good ones that are related to ADHD behaviors, which means that teachers need to understand the behaviors. And we've got to also remember that if we are going to be giving pills to children, it's really, really important that we teach them skills as well. Because, you know, an ADHD child is like a Ferrari with bicycle brakes. Yeah? Our clinician has the power to give that Ferrari brakes. But there's no point putting those Ferrari brakes on a Ferrari if we're actually not going to teach the child how to drive that Ferrari. Okay? So those skills are the lessons we're going to teach our children to drive their Ferrari. Thank you.
Thank you very much, Andrea. There are questions about these talks. Yes, can you show the slide where is the information about 1, 2, 3 magic approach? Yep.
That one? That one?
Yes. Okay, you have mentioned before this type of approach that you use in your association.
Yeah.
And what are the characteristics of this approach
How do you mean?
in terms of parents and teacher training?
I don't really understand what you want to know.
Yes. It is a behavioral management program.
Yeah.
Okay.
It works on some interesting principles, and it works on principles that actually go against many parenting programs. Because the 1, 2, 3 Magic approach, how it works is, we call it a no talk, no emotion program. It stops parents yelling at their children, so we don't talk to them. There are various strategies that we use. We train the children to do what we want them to do, to get the behavior under control. And while we're training them, we don't have conversations. If you start an argument with your child, just say your child is jumping on the sofa, and you want your child to stop jumping on the sofa, and you shout, most parents will shout, get off the sofa, and the child will shout back, I don't want to get off the sofa, I want to jump on the sofa. And then you shout back at your child, don't you jump on the sofa, you're a naughty child, and I'm going to put you on the naughty step. And you get this interaction that goes on until it ends up with screaming, yelling, and possibly hitting. Because the minute you engage in that kind of talk, you're inviting that response from the child. So we use it's a time-out approach. The child is going to get 2 chances to stop jumping on the sofa and will then go to time-out. And we don't have a conversation about it. And when they come out of time-out, whatever's happened, we don't talk about it. It's finished. It's a clean slate. We move on. We have a smiley, happy face. Okay? Because we're training them. And it's not that we don't ever talk to children, but the program has so many different components. The first part is how we stop that difficult behavior. The second part is how we encourage the positive behaviors, like making your bed, doing your homework, tidying up, your chores, going to bed, going to school, getting dressed. And then the third part is how we talk to our children, how we work as a family, family meetings, having fun with our children, enjoying them. But it's a brilliant program because you can stop a child in a classroom. Teacher can stand here in a hall and can stop a behavior at the back just by holding up one finger. But that's why it's called 1, 2, 3 Magic, because it works. It's 2 days of training. I couldn't possibly share it all in one go, but it's okay.
Thank you. Other questions? Okay, thank you, Andrea, for your talk, and I